To The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Welcome, welcome. We're glad everyone joined us today on our program, Heart of Health Live, you're watching. And if you might be flipping channels, we're glad you join us. Stay with us. We have some very important information today. We're going to be talking about depression. And unfortunately, up to 1 in 4 of us suffer some form of depression or some element of depression. So it's something that everyone wants to learn about. If not only for your friends, you can help a lot of people by listening. We have an expert in the field of depression with us this evening. It's Dr. Tim Jennings. Dr. Tim Jennings actually practices and sees real patients every day. He takes care of lots of people. He's also the president-elect of the Tennessee Psychiatric Association. That's a big word, but that means that he's well known amongst his peers and they respect what he's done. He's an author of 2 great books, one of which is on bookshelves right now called Could It Be This Simple? Another one that's going to come out later in the year, about probably April or May. You can start talking about pre-ordering it. But these books I've read personally, and they also shape the way I treat cardiology because I realize that all disease, much of disease we have, comes from the brain. And unfortunately, when a brain is depressed and doesn't feel good, it affects the entire body, raises the chance of infection, raises the chance of cardiovascular disease, raises the chance of accidents and missed days at worst. It hurts our relationships with each other. It also hurts our relationship with God. So this is a program you definitely want to stay tuned on. Our lines are open right now, so we want you to give us a call, 855-644-3278. You can also, if you don't want to talk on air, you can leave your questions with one of our capable call center people. You can also join us on Facebook, be part of the discussion there, or become one of our Facebook friends. Dr. Tim Jennings has so graciously agreed to be with us, and if you stay with us, you're going to get to share in his expertise after we go to this short break. Stay with us.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
3ABN Music presents.
Don't give up, heaven's on your side.
Danny Shelton's Don't Give Up, Heaven is on Your Side.
There's power in the name of Jesus.
This new music project features songs written by Danny Shelton and is on CD for a suggested donation of $16.50. Also available is a DVD and an accompaniment track CD. Contact 3ABN during our regular business hours and receive a CD and DVD combo or music and accompaniment track CDs for a suggested donation of $25. Everything is postpaid in the U.S. Call 3ABN at 618-627-4651 or go to our e-store at 3abn.org. Danny Shelton's Don't Give Up, Heaven is on Your Side on CD, DVD, and accompaniment track CD.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
If you've just joined us, we're talking about depression, and we're so glad that Dr. Tim Jennings has joined us. Dr. Jennings, thanks for giving us your time.
Thanks for having me.
Listen, tell us what got you interested in the field of psychiatry. So many branches of medicine you could have gone into.
You know, when I decided to go to med school, my plan was to be a cardiologist.
Okay.
Yeah. But then in med school, I obviously went through the various rotations. And when I went through the rotation for psychiatry, I discovered that the brain is actually the most complex organ in our body. And I was just drawn to the complexity of the brain and the mind. And so that's what I went into that field.
So to become a psychiatrist, you have to become a medical doctor first.
MD, yep.
And you learn about all the fields of medicine.
Absolutely.
Okay. And then what do you do beyond that?
And then they have a 4-year residency in psychiatry that has a heavy emphasis on neurology. 1/3 of a psychiatrist's board certification exams is actually neurology. So it's a really heavy emphasis on understanding the brain and neuroscience in order to be a psychiatrist.
Okay. And then after you finish that, I guess you've been practicing for a while?
I've been practicing for over 20 years now. Yeah.
Now, what got you interested in writing books?
Well, what got me interested in writing books was patients that would come to me and have problems and when so many misunderstandings and so few resources out there that actually put a balance. And what I really have a passion for is integrating science and Scripture, integrating what I understand how God designed life to operate with the evidences that we have before us in the scientific world, and bringing those two together in a way that people can understand it and apply it functionally to their life.
Wow. Now, if you look at society now, I think our mental health is as bad as it's ever been in the history of the earth. Would you agree?
I wouldn't disagree. I will tell you, I never thought of it like that throughout the whole history.
I mean, but you know, you think about it, it's a major medical problem, and it's like we have to deal with it. Just give it, since we're going to focus on some depression, just tell me about depression. Let our readers know. Give us a sort of a brief overview.
Yeah, when somebody is depressed, this is actually a physical illness of brain and body. Okay. The part of the brain that we reason and think, right here behind our forehead, this part of the brain, it organizes, plans, and it also modulates mood, is depressed or suppressed. It's not active as normal when someone's depressed.
Okay.
So the person who's depressed has trouble thinking clearly, concentrating, problem solving. Part of the brain right above the orbit of your eye is the part of the brain that gives you a conviction of wrongdoing, redirects from inappropriate behavior. So if you were at church this weekend and you tried to stand up and take your clothes off in front of everyone, okay, this part of the brain would start firing like crazy, and you'd get really uncomfortable and stress and feel, because this part of the brain is trying to redirect you to get you to stop this inappropriate behavior. Okay. When someone's depressed, this part of the brain is actually overactive, so they get a sense of guilt, a sense of inadequacy, a sense of everything they do is not good enough or not right. A part of the brain behind the bridge of the nose, about a few inches back, it's called the anterior cingulate cortex. This part of the brain is where you experience empathy, compassion, connectedness with other people, and it's also the place you make decisions. Okay. And this part of the brain, when someone's depressed, is underactive. Okay. So people feel emotionally disconnected, and they have difficult time making decisions. The part of the brain where you experience fear, called the amygdala, is overactive in depression, so people also have this sense of apprehension and dread, worry, anxiety. And then the part of the brain where you experience pleasure, all pleasure, called the nucleus accumbens, whether it's that runner's high, whether it's your favorite food, whether it's just fell in love, all pleasure. When someone's depressed, this part of the brain is not reacting. So when people are depressed, there's this constellation of symptoms based on a brain circuitry that's out of balance, where they have trouble concentrating, focusing, they have trouble with decision making, they have emotional disconnect, they feel guilty and inadequate in everything they do, they have a sense of dread and worry and apprehension, and then when things actually go good in their life, there's no joy in life anymore. Now, when the brain circuits are out of balance like this, the fear circuitry is overactive, and peripherally what that does in your body is it actually activates your immune system, causing an inflammatory cascade.
Okay.
This is devastating to the body. The elevated inflammatory cascade results in insulin resistance in the face of high stress, and high stress causes the stress hormones, glucocorticoids, to release, which means it's pumping glucose into your bloodstream for that fight or flight stress response. But now we're having the inflammatory cascade causing insulin resistance, so we're not able to use that glucose as well. So this chronic imbalance that happens with depression from the brain circuits cause increasing risk, as you mentioned in your opening, of cardiovascular disease, obesity, diabetes, hypercholesterolemia, stroke. Even bone density problems we have problems with osteopenia, osteoporosis for people who are depressed.
Wow.
Now, this inflammatory cascade, one final step, so there's a three-way process here. Brain circuits out of balance cause an inflammatory cascade, cause physiologic health problems. That inflammatory cascade now reacts back upon the brain, causing cellular damage. Cells in the brain begin to be damaged. I won't go through all the technical pathway through that happens, but we actually lose brain volume. Parts of the brain start shrinking. Now, I brought a functional scan to show our audience. And on the left, we have a brain that is not depressed. And on the right here, we have a brain that's depressed. And what we're actually seeing here is the bright areas are cells that are using glucose. They're firing. They're talking to each other. They're active. And the cells that are dark, that are not doing anything, these are not dead cells. It's not a stroke here. These cells are just dormant. They're just not active. They're kind of just sedentary and not doing much. And that's what's happening in the brain of people who are depressed.
Wow. So a lot of stuff's going on. So the diagnosis of depression, you mentioned some of the symptoms. Is it just talking to people to tell if they have these brains, or do you have to scan everybody?
You actually certainly could do a scan, but there's no need to do a scan if you have an experienced healthcare provider who knows what they're looking for. But somebody can come in and look like they're depressed and not actually be depressed, and that's why it does take somebody who has some clinical experience to know how to differentiate between somebody who actually has depression and somebody who doesn't. Now, what's interesting is just once somebody has depression and we have this physiological process going on, that still doesn't tell us why they have depression. And that's the critical thing to wellness. To get somebody well, it's not just enough to say, okay, you've got depression. You have to then start asking those critical questions. In this particular person who sits in my office right now, what's going on in their life that their brain circuits and their body inflammatory cascade is out of whack here, causing depression? So if you remember how those circuits were out of balance that I just described, anything going on in life that will imbalance the circuits that way, decrease dorsolateral prefrontal cortex, upregulate fear circuitry, for instance, anything that does that will push people into depression. Or anything that causes higher inflammation in the body will push people towards depression. Right. And so we have multiple different avenues that we can push people in the direction of depression. And so when someone's depressed, we have to look at them as a total package and say, okay, what has gone wrong where, and then begin a holistic treatment plan to get their body and their brain back in balance.
Right. So depression might just be something physical.
Oh, depression is something physical.
Yeah, it's something physical, but something could trigger, like a disease could make depression come on.
One of the major factor for depression is the worsening physical health problems you have. Every organ system of your body has as its primary purpose to serve your brain.
Right.
Okay? So the more physical illness you have, the less effective your body can keep your brain healthy, so the more you're pushed towards brain dysfunction and depression.
So when you think a person might have this, one of the first things I guess you would do is to complete physical and make sure there's not contributing factors.
Actually, certainly we want them to have a complete physical exam, good lab work done, hypothyroidism, certain sleep disorders are contributing factors to depression. A lot of these things are involved.
So once you look at all that and say, listen, I've corrected this and I've corrected that, we're going to talk a little bit about the specifics as we go on today about how you address this complex clinical problem. So depression's pretty, now there's, you got the brain there, which is the part that does the thinking for those that don't know very well.
The part of the brain here in the front, this is the dorsolateral prefrontal cortex. This is the part where we reason and think. And when someone is depressed, it's not as active. Okay. And this is the part we want to turn back on. And there are certain avenues through which this can happen. One is, you were talking the physical health problems, but also the thoughts that we have. If people are taking actions that are out of harmony with God's design and they have guilt, for instance, guilt can disrupt this circuitry, unresolved guilt.
So the first thing you do not do is just reach for medicine.
Well, medicines, we should talk about that because there's a place, but they're really overused.
Not the first thing you think about.
Yeah, we need to talk about that.
Brenda, we're going to be back and answer your question with Dr. Tim Jennings. Give us a call. We're at 855-644-3278, and you're watching the Heart of Health Live.
Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our guest this evening, if you've just joined us, is Dr. Tim Jennings. He's a psychiatrist that actually sees patients every day. He's president-elect of the Tennessee Psychiatric Association. He's written some great books out there. His website, one of his websites is comeandreason.com. And Dr. Jennings, we were talking a little bit about medications. You know, sometimes I have patients come in, they talk to their family physician and they gave me this medicine right away. Is that the way we should be doing things?
I would tell you, in America, the #1 treatment for depression is antidepressants. But they're overused and they often don't work. In fact, there was a study done by the National Institute of Health where they took patients and were cherry-picked patients. When I say cherry-picked, either never been treated before, or if they'd ever been treated, they always got well. So they excluded people who failed to respond. And then they put them on one of the SSRI medications. Okay. How many percentage of those patients do you think got well?
Oh, no, how many?
27%. 73% of the patients did not get well on antidepressants. And then they went through a whole series, but the point is every time they switched them, less percentage got well than the 27%. And so medicines as a single and sole treatment are not really ideally. We want to look at the person holistically. And one of the reasons why medicines don't work well and you get such low response is in order for the way the medicines work, maybe the audience would like to know this. When one neuron wants to talk to another neuron, the neuron releases chemical in a little gap called a synapse. Mm-hmm. When the neuron that releases the chemical has released it, there's a little vacuum cleaners called reuptake pumps that will suck that back in, repackage for the next signal. Medicines, almost all antidepressants, block those pumps, shut them down, so when the neuron fires, it leaves the chemical out here in the space longer. But guess what happens if we block them? It doesn't fire. See, if it's not releasing anything to block those pumps, there's no big impact. And remember, patients' brains, when they're depressed are like this, these neurons are not firing normally. And so this is one significant reason why depressions or antidepressants don't work well for a lot of people. Yeah. Not to mention all the risks and side effects and other problems you get with them.
Well, I'm glad you understand that, because many people don't. You know, they jump right to the medicines first off. Brenda, you're on with Dr. Jennings. Can you go ahead and ask your question or comment?
Okay. Hello, Brenda.
Yes.
Okay, go ahead. You're on with Dr. Jennings.
Okay. Dr. Jennings,
Yes.
my family, well, first off, I've got manic depressive, bipolar, and schizophrenic tendencies. My family treat me as if I am a retard. They want to take over my life and hold on to my money, which I had put in my, sister's name and my name for my mama's sake. But she's dead now, but they still don't trust me.
Did you have a question for me, Brenda?
Yes. How do you get your family to understand?
Mental illness.
Yeah. So thanks for calling, Brenda. First off, for the audience, let me clarify. She mentioned she had bipolar disorder, manic depression. The old terminology for this illness was manic depression. And in 1980, it was actually officially changed to bipolar disorder. So bipolar disorder and manic depression are technically the same illness. So, it's the same illness. And this is an illness in which you not only have depressions, you then have elevated periods of excessive and expansive energy with a mood, decreased need for sleep, racing thoughts, and oftentimes, sometimes people in a full manic episode will become, have loss of touch with reality where they become grandiose, delusional, and so forth. If that's happening, then what happens is many families will have to step in to intervene to help protect a person from spending money that they don't have, going into terrible debt, and making impulsive decisions that are destructive. Unfortunately, what can happen, though, is when that happens on an occasion because of a moment of decompensation, the family can sometimes then conclude that this is the way they are all the time. And so the question was, how do we help educate the family? Well, first you have to demonstrate to the family that when you're not either in a depressed or manic state, that you can actually function in a stable way. And most of my patients who have bipolar disorder, when we get them on the proper regimen, they actually are very stable for long periods of time and function completely normally and don't have symptoms that would cause anybody to think there would be a need to step in. So I think the first step would be that you would need to make sure that you are taking responsibility and living in a high-functioning way in every aspect of your life. Then you would want to go and educate your family that you appreciate their interventions in your life when you have those moments where you need their help and oversight, and then maybe draw up an agreement with them about certain symptoms. When they manifest, that's when you want them to step in and help you.
So, Brenda, there's a plan for you. You catch all that?
Yeah, I think she's gone.
Okay. Well, Brenda, thank you for your call here. That's good advice. You have to sort of prove yourself.
Yep.
Prove yourself to be stable. We have a question from California here. It says, this person wants to know the relationship between Parkinson's disease and depression. And that's part one. And is there anything that he can do for it?
Yeah, that's a great question, and it's an interesting. Parkinson's disease is neurodegenerative. The part of the brain that controls motor movement, smooth motor movement, the initiation of motor movement. We've discovered that with the brain, it not only controls motor movement, but it also initiates thinking. And so if you know anybody with Parkinson's disease, you'll notice not only do they have less spontaneous movement of their body, they have less spontaneous expression of their face and less spontaneous thinking, because the part of the brain that initiates those types of movements is affected if it's degenerating. And so yes, there is a relationship with Parkinson's disease because neurons are dying in the brain that give us motivation, initiative, drive, that get up and go, that gets us moving. They're dying, okay? And that gets our thoughts moving as well. And what can be done for it, and my understanding, what needs to be done is you need to see a neurologist, and there needs to be some type of physical intervention. And that physical intervention could be a deep brain stimulator, perhaps, if you don't want medication. I know there are research on stem cell research that's going on in some places. But the most common, of course, is various medications of some kind to increase the amount of dopamine, which is a neurotransmitter in the part of the brain where the neurons that produce it are dying.
Wow. So I think that brings up a couple things that I want to talk to you about. Is that it seems like, we talked about, like the thyroid affecting your brain can trigger. So sometimes like one brain disease can trigger another brain disease.
There's no question.
Parkinson's can trigger depression.
Yep. And people who have depression, one of the risk factors for Alzheimer's dementia is having a history of depression. Because the history of depression, as I went through before, is that inflammatory cascade. And the more inflammation you have throughout life increases your inflammatory damage to your brain, which is a factor for getting dementia later in life.
Wow.
Yeah, and since we talk about inflammation, I just want to throw this out there as well. A recent study came out and showed that people who eat fast food or junk food have a 40% higher rate of depression than people who eat a more healthy, holistic diet. And the reason for this is the fast food and junk food is very highly inflammatory. And you increase inflammation, you hold that whole cascade of events, you increase risk of depression. So lifestyle and healthy lifestyle choices are very important in physical health, which promotes good brain health.
Wow, that's interesting. Now, I'm going to handle this one here. One caller says, can daily stress affect urinary symptoms, you know? And I would say that is definitely possible. It could affect urinary symptoms, but you want to make sure you don't have any other urinary tract problems. If you're a man, get your prostate evaluated. If you're a woman, make sure you don't have a urinary tract infection. Remember, any type of stress revs up the body. And, you know, when the body's under stress, it does things, it triggers things. So, but you want to get a good exam on this and make sure there's no other physical problem before you blame these symptoms on stress. You know, some people that have lots of stress, they have to go to the bathroom all the time, things of that nature. So, but stress is bad can make almost any organ system worse. Dr. Jennings, we have a call coming up from Indiana after the break, but we're just glad you're joining us here. We're here with Dr. Tim Jennings. He's president-elect of the Tennessee Psychiatric Association. You can join us here by calling 855-644-3278. You can join our ministry and see what we're doing at heartwiseministries.org. We love for you to be one of our Facebook friends. You know, Facebook is a way many people are talking with each other. We're learning about depression, how it affects the body. Lots of people have it. It affects many of us. So if you just join us, come on in, join the discussion, learn something about depression. We have Dr. Tim Jennings, who's serving us today by giving his time to help us all learn more about depression. Stay with us. We're going to be back talking to Ursuline from Indiana after our short break.
The Heart of Health Live will return in just a moment.
You have reached that point in life where important decisions are being made. A charitable gift annuity through 3ABN gives you a way to financially provide for you, your spouse, and the ministry of 3ABN. Many do not realize that they can fund a charitable gift annuity with as little as $5,000 for a single annuity and $10,000 for a joint annuity for a husband and a wife. Remember, a charitable gift annuity may further reduce your tax liability, and it's a fixed interest rate for life based on your age.
I am 94 years old, and I earn over 9% on my investment.
For more information, contact 3ABN Planned Giving and Trust Services by calling 800-886-4800 or go to our website 3abn.org and click on the Planned Giving and Trust Services tab.
Hi, I'm Dr. James Markham, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We are glad you've taken time out of your busy schedule to learn about depression. We're also answering questions in the field of psychiatry with Dr. Tim Jennings, President-elect of the Tennessee Psychiatric Association. He's speaker, director, president, whatever, of a ministry called Come and Reason, and his website's comeandreason.com. We invite you to check that out as well. Right now we have Ursuline, I might have said that, from Indiana. You're on with Dr. Tim Jennings. Go ahead.
Hello, Dr. Jennings. How are you?
Hello, how are you doing? Thanks for calling.
Thank you for taking my call. The reason for the call is I'll give you an elevator speech. 1985, I had an encounter of a first panic attack. I was actually in a car as a passenger. It progressed and got worse. My medical doctor, which is a secular doctor, he put me on Xanax and Paxil. So I ended up with Xanax for 30 years. Now it's at the point that I had to take more Xanax than what was, because I found out it is an addictive medication. And now I'm not even able to, at this point, to even be a rider on the highway. It's basically in a highway and where there's a space. So I've seen a psychiatrist and a therapist. They were secular, but I'm still on medication. God's got some awesome things for me to do in life, but it's holding me back. It's a stronghold, and I'm ready to be rid of this. What would you suggest?
Well, I'm glad you called, because panic episode is not unusual. Almost everybody will have a panic episode sometime in their life. But panic disorder is when somebody has recurrence of a recurring process of panic over and over again. And panic itself is actually very amenable to your thinking and changes in thinking and perception. And so one of the things that can happen, I'll just give you a simple example there are multiple contributing factors and reasons why people have panic, but I'll give you one simple example. Just imagine you're in a circumstance where somebody's holding your head underwater. And 5 seconds, no big deal. Maybe 15 seconds, no big deal. But after 20, 40, 50 seconds, we're going to start panicking. Anybody's going to start panicking. Your head's underwater at a certain point. Now, when you're having that panic, if somebody comes swimming along, say, Dr. Jennings, I'm swimming along with a snorkel and mask, and offers you some Xanax to help you relax, that's not really what you want. What you want is you want your head above water. Well, sometimes we can find ourselves in situations in life where we have so many things and responsibilities coming down on us, so many burdens, expectations, demands, deadlines, people after us, and people will say, I just don't feel I can get my head above water. But they're not talking real water, they're talking psychological water. But when they get in that circumstance, they'll start actually panicking, just like if they were under real water. And that's just one example, and there are many other examples that psychologically contribute to this sense of drowning or this sense of panic. Additionally, one other one is that once somebody has had panic on more than one occasion, they often become afraid of having another panic attack.
Yes.
Okay? And the fear of having another panic attack actually causes panic attack. Okay? And so one of the things I teach my patients, and sometimes it takes more than one session to teach them this, but I ask them, and I'll ask you, how many panic attacks have you had in your life, approximately? 10? 50? 100? 1,000? How many?
Over 100.
Okay.
Yeah.
And how many of them have killed you?
None.
Okay, so have you figured out from your own experience so far that as bad as they feel, they're not dangerous?
Yes.
You hesitated because they feel really bad, don't they?
It makes me want to jump out, like my ex-husband had to lock the doors because I wanted to jump out of the car and run into a building or be somewhere in a building. So
the first thing you have to recognize, if you really want to move past this, is to recognize from your experience, not because Dr. Jennings said it, but from your experience, that as bad as these feel, they are not harmful. So that in your mind, because what happens when people have had these, they're so afraid of having another one, they become hyper-vigilant. You begin monitoring your own body signals, and you look for the little sharp pain that might be going through as a gas bubble goes through your gut, and you go, oh no, not another one, and you actually trigger the whole panic thing happening. And so the first thing you have to do is you have to stop being afraid of panic. They can't harm you, they can only feel bad. And so you shift your mental attitude towards panic from fear to dread or dislike. Have you ever had menstrual cramps?
Yes, I have.
And can they interfere with your functioning?
Yes, they did.
And do you like them?
Hysterectomy. No, I didn't.
Are you afraid of them?
I wasn't afraid of them, but I didn't.
That's the attitude you have to develop towards panic. They can interfere with you. You don't like them. They don't feel good, but they're not dangerous, so I'm not going to be afraid of them anymore. If you can make that switch in your mind, you will reduce your panic by 75% without even doing anything else. And then if you follow up with a good therapist that can help you get some of the other cognitive things that are going on in your mind that contribute to panic, you can probably get these things knocked out in a few months.
Thank you.
All right. You take care. Thanks for calling.
Thank you.
You're welcome.
Goodbye.
Wow. That was some great. That must be scary to have those type of feelings, but that was some great advice. We have another question that's come in and says, in depression, are there some natural remedies that I can do for depression?
Okay, this is a great question.
Yeah.
And to answer the question, I want people to remember what we talked about earlier, how the brain circuits are out of balance, okay? And how there's a high inflammatory cascade going on that are pushing people to depression. So to the degree we can reverse that process, then we can help treat or put the brain back in a healthy direction. So change in lifestyle, removing the high inflammatory foods. Okay. Adding in anti-inflammatory foods, which would be fruits, vegetables, and things like this that are high antioxidants. And then there's certain nutrients that are very important for brain health that actually have shown to help mood-stabilizing effects. Omega-3 fatty acids, and I won't go into all the details on that right now. If we have time, we'll come back to it. N-acetylcysteine. N-acetylcysteine is a mitochondrial membrane stabilizer. Mitochondria, little organelles inside your cells that produce energy. When people have mood disorder, they're dysfunctional. They kick out lots of free radicals. This is damaging to the brain. When you take N-acetylcysteine as a supplement, it actually stabilizes those membranes and actually improves not only cognition, but it stabilizes mood. L-methylfolate. L-methylfolate is the metabolized version of folic acid. Only the metabolized version of folic acid crosses the blood-brain barrier where it's a required cofactor for your brain to make neurotransmitters like dopamine, norepinephrine, serotonin. Now, this is what people need to hear. 70% of people with depression have a genetic mutation where their body does not metabolize folic acid from food in the form the brain needs. So even if they're getting it in a regular vitamin or getting it in food, if they have this genetic mutation, it's not getting in the brain. Antidepressants do not cause the brain to make neurotransmitters. Antidepressants affect the machinery that transports them. So if we use a little analogy, Little Debbie factory makes Little Debbies. Trucks move Little Debbies around. Antidepressants are working on the trucks. L-methylfolate causes the factory to make more. So if we have an L-methylfolate deficiency, factory shut down, we give meds, we may speed up the trucks or affect the machinery that transports them, but we don't have any neurotransmitters, so it's not having a big clinical impact. So this is another thing to do. Also, physical exercise.
Okay.
When you exercise regularly, your muscles produce interleukin 10, which is a very powerful anti-inflammatory interleukin that suppresses those inflammatory factors that we talked about earlier. Also, exercise causes the brain to produce endorphins and enkephalins, which help mood. And more importantly, regular exercise turns on multiple different neurotrophins. Neurotrophins are proteins that cause the brain to make new neurons. So you actually will sprout new connections, make new neurons. A study done of elderly people showed that if they exercise regularly, they actually could measure 2% growth in the memory circuits of the brain. It's called the hippocampus, which reversed over 2 years of aging just by exercising regularly. So physical exercise is critical to good brain health. So all of these things, and then healthy spirituality. If people meditate on a God of love and worship a God of love, we can actually measure, and I won't go into details of how it worked, but the studies show we can measure growth in the love circuit of the brain and calm the fear circuit of the brain from doing this within 30 days' time. We could actually see this kind of change happening. But if we worship and meditate on fear-inducing God constructs, wrathful, punitive, appeasement-needing God constructs, this actually was damaging to the brain, causing increasing fear and anxiety and inflammatory cascades. So that's why we focus on teaching people about a God of love.
Well, that's great. Glad you joined us. Our number is 855-644-3278. You're watching Heart of Health Live. You still have time to give us a call. Don't go away. We'll be right back.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Markham is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Markham dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
The Bible says, "Man shall not live by bread alone, but by every word that proceeds from the mouth of God." To understand the Bible better, visit itiswritten.com. We have several series of Bible studies that will be a blessing to you. You can study the Word of God and grow in your faith in God and in your knowledge of the Bible. Study God's Word anytime, right on your own computer. Visit itiswritten.com for wonderful studies of God's Word.
3ABN presents Love Rules.
Isn't it cool that love rules? Isn't it great? There's no hate where love rules.
Love Rules features Danny Shelton, backed up by talented children who love to sing for Jesus.
Love the Lord with all your heart and love your neighbor.
Each song is based on Bible truths, and many of them blend scriptures into the lyrics.
Jesus said, "Go ye into all the world." If he said it, we can do it. Yes, he said it, so let's do it. Take the gospel into the world.
Love Rules is available on CD for a suggested donation of $16.50. Love Rules is available on DVD for a suggested donation of $20. Love Rules is available in an accompaniment track CD for a suggested donation of $35. And don't forget about the Love Rules Songbook, available for a suggested donation of $15. Everything is post-paid in the U.S. To order Love Rules, contact 3ABN at 618-627-4651 during regular business hours, or go online to our e-store at 3abn.org. Love Rules. Refreshing songs will keep you singing all day long and draw you closer to Jesus.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Hi, I'm glad you've stayed with us. We're answering questions not only about depression, but about different mental illnesses. I almost tripped over that word. And it's a big deal. 1 in 4 of us suffer from it. The world we live in puts a lot of stress, and there's lots of physical things. And if you have mental illness or think you might be getting it, this is what we want to treat. We want to do these things so we can prevent things. We have a quick question here. This person's taking Zoloft. Is this a good medicine for depression?
It is no better nor any worse than any of the other antidepressants on the market, really. The question is, are you well on this with no side effects? Then it's a good medicine for you.
Right.
So that's the deal.
And the success rate of any of these?
They're basically all the same.
Yeah, they're not.
None has really been shown to be better than the
others. And it's
others.
just sort of mix and match type of thing, isn't it?
Yeah, different people respond differently to okay. Some do one with well, another with different one.
And this is a question that deals with watching Christian videos. Versus watching secular TV. Can different types of things we watch?
For children or for adults?
For children. It says specific for children. What type of things should they be watching?
You know, this is very critical. And before we answer the question, you need to understand a little about normal brain development. When a baby is born into the world, the baby's brain has hundreds of millions of neurons more at birth than that brain will have by the time the baby is 8 years of age. For the first 8 years of age, regardless of the child environment, if it's a healthy environment or not, the brain is busy knocking off neurons by the hundreds of millions. That doesn't sound too good, but conceptualize it as Michelangelo's block of marble when Michelangelo gets it, and Michelangelo's block of marble when he's done with it. When he's done with it, he has less marble, but he now has a masterpiece. Mm-hmm. The brain comes into the world prepared to be acted upon by education, environment, experience. Neural circuits which are being exercised and used will actually expand. New neurons will be recruited to it. That neural circuitry will get bigger and more complicated. But neural circuits which are not being used will be pruned back and deleted. Okay, this is normal brain physical development. So when we understand that, then we can think, okay, what about television? What's it going to do to the brain, and how's it going to affect it? And the critical thing, a lot of people say, well, is it rating, G rating versus R rating? Is that the critical thing? It's not. That's actually secondary. The critical thing is whether it's theatrical in entertainment in nature or educational in nature. Theatrical television has its primary function on the brain to activate the emotion circuits of the brain while simultaneously turning off prefrontal cortex where you reason and think. The theatrical programming that we watch, it wants to get an emotional reaction, to get you to laugh if it's a comedy, to get you to cry if it's a drama, to get you to be afraid if it's a suspense, to get you irritable or angry in some movies, but it's to get an emotional reaction. And the more intense the emotion, then the better the programming. And while simultaneously turning off your thinking parts. And if you don't believe me, if you watch theatrical television, the next time you're watching your favorite show, actually start thinking about it. Start asking critically the whole way through, what's the likelihood this could happen in real life? And if you do that, you'll suddenly find, hey, this isn't as enjoyable. We enjoy it when and I've done this with friends, and they say, hey, you're not supposed to think about it. Okay. Now, when you understand that, then you understand the more television you watch, the more activation of your emotion circuits you get, the less activation of your prefrontal cortex where you reason, think, plan, problem solve, self-restrain, self-govern. Okay, so when kids hit adolescence and they've had a brain that's watching a lot of TV, then the hormones that inflame those mood circuits, they become moody, irritable, impulsive. They often act out, and they will often turn to alcohol and drugs to try and calm down a circuitry that their prefrontal cortex is no longer capable of restraining. And I won't go to the studies. There's a lot of studies that show, have documented this, that whether it's R-rated or G-rated programming, if it's theatrical in nature, you have impairments in attention, impairments in focus, impairments in self-governance, in more impulsivity, these types of things. And the study done by Centerwall, published in the Journal of American Medical Association, actually showed that theatrical entertainment increased the rates of homicide in society because you become less you become more disinhibited or less inhibited. You can't restrain those impulses as much. Whereas educational television did not show any of those problems because educational television is designed to exercise these prefrontal cortex. So it really doesn't matter if you're watching theatrical Christian programming or theatrical non-Christian programming, you're still firing emotion circuits and not prefrontal cortex circuits, so you're not going to develop the prefrontal cortex like you should. And this is actually a higher risk factor in both behavior, attention disorders, anxiety disorders, and mood disorders. All of them will be increased if you watch a lot of theatrical programming.
Wow, that's very interesting.
And fortunately, our program that we're doing tonight, this is educational programming. So you can watch this and record it and watch it over and over again.
There you go. There you go. And if you want to, you can watch it on their website. Again, that's heartwiseministries.org. You can watch this program. It'll be on all the time. You can always go and download it if you missed something, because Dr. Jennings talks very fast. You can always go back and watch it again. Kay, from Alabama. You're on with Dr. Tim Jennings. Go ahead.
I just wanted to share briefly with you that in 1990 I was diagnosed with bipolar disorder, but I don't have extreme manic things, and I don't get extremely depressed. I've done a lot of research, and I believe that I have PTSD, and I read a book called EMDR by Francine Shapiro, and the treatment seemed like, when I read the book, that they would be ideal for me, and I wanted to know if you know about EMDR, and what is your opinion of those treatments?
Yeah, thanks for calling. And I'd like to first say to our audience that bipolar disorder is one of the disorders that's most commonly misdiagnosed.
Okay.
About 70% of the time, it's misdiagnosed. Okay. And it's missed on both sides of that equation. Patients with it don't get diagnosed properly as bipolar, and many patients get diagnosed as bipolar who don't actually have bipolar. And there's a lot of things that can mimic or look like it. Attention deficit patients, because of the prefrontal cortex dysfunction, can have mood instability and get wrongly diagnosed as bipolar. Post-traumatic stress people, particularly if the trauma's happened in childhood, not in adulthood, generally will grow up with a lot of mood instability that can be misdiagnosed as bipolar disorder. So now to your question about the EMDR. This is a therapy that is designed to help people with trauma issues, process those trauma issues, and basically make different and new neural pathways for handling those emotional memories. And basically, while you're processing the emotional memories, they're having you do some rapid eye movements, and the rapid eye movements are simultaneously activating the neural circuits that fire the motor movements of the eyes, and that seems to have an impact on what's going on in the brain. So it allows you to process those things without going down the same old, recurrent, habitual, dysfunctional pathways. So some people have found it very beneficial. It would be reasonable for you to explore.
Kay, is it helping you? Have you tried it?
I've not tried it yet, but I do have an appointment for the psychologist that I spoke to said that 3 treatments would probably be all I would need. So I'm really encouraged by that, because I've been on medication for bipolar disorder since 1990.
Yeah.
Well, I encourage you to go try it and see if that helps you.
Yeah, Thank you very much. That's what I wanted to hear.
You're welcome.
You know, that was very, very interesting, Dr. Jennings, that you point out misdiagnosis.
Mm-hmm.
That's a large number.
A lot. It's huge. Bipolar disorder is very difficult to diagnose. People, they're for instance, when she first started talking about, I've never really had the high highs or the low lows, but I've had a lot of mood instability, I thought she might have been describing cyclothymia, which is exactly that, 2 years or more of somebody whose mood is just up and down, but never high or low. But you know, she mentioned PTSD, and patients with childhood traumas often have this mood instability. They have difficult time regulating their moods.
So I guess, you know, when I see patients come to me in the office and they're on these medicines for bipolar, you know, 3 out of 4 misdiagnosis. And yet some of these medicines interfere with some of the medicines I give.
Well, you know, sometimes, you know, I say that doesn't mean the one you're seeing is misdiagnosed.
Right. Hope not. Okay. Well, we're running out of time now. We're just glad that Dr. Jim, we have one more segment. We're going to try to get to your call real quick, Jessica, after the break. But if you have any questions or concerns, go to our website, heartwiseministries.org. We're with you every week. You can also watch these programs live, and we're with Dr. Tim Jennings, who's president-elect of the Tennessee Psychiatric Association. His website's comeandreason.org. He has a great book out, Could It Be This Simple? I invite you to look at those resources as well. We're going to be back with Jessica with a quick question after this break, so stay with us. Jessica, we're going to be back with you after just a moment.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance. When to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're glad you joined us. We're with Dr. Tim Jennings. We're talking about psychiatric and mental illness. And Jessica from Illinois, you're on with Dr. Tim Jennings. Go ahead with your question.
Yeah, what I wanted to ask was I've had panic attacks for over 25 years, and he was talking to the previous caller about changing your thinking. I was wondering if I change my thinking, even after this long, can I still get over this? And is there any natural things I can do to help in that direction?
Yeah, actually, have you seen a therapist? Have you gone to a psychotherapist or a psychiatrist that does psychotherapy?
Well, I was on Xanax. I've been on Lexapro before, and I've also done counseling.
Yeah, well, yes, the simple answer is yes. Panic disorder, regardless of how long you've had it, is extremely amenable to change in thought processing. And so if you get with the right person who can actually help you process through in your mind what it is that what's triggering these things, panic is with the rare exception of somebody who's got a very, very rare disorder called pheochromocytoma, and that's extremely rare. What is it, 1 in several 100,000, okay? And so I'm sure you don't have that. With the rare exception of somebody like that, panic disorder is almost always due to some type of thought or perception that you have, conscious or unconscious, that triggers it. So therapy is very, very, people are very responsive to therapy. So if you haven't had that type of response, then find somebody else to go to.
Okay, thank you.
And
You're welcome.
always do some shopping around, you know?
Right.
If they're not getting the job done,
well, I'm going to tell you I'm going to tell you there's a flaw in the mental health system. In the mental health system, with the DSM is Diagnostic Statistical Manual, which is a great communication tool. It helps us. Somebody says, I got depression. Okay, I know something already. That's great. But what happens is a lot of people have gone down with a symptom checklist, and they make the diagnosis, and now they think okay, you've got this diagnosis, panic. Now I know what's wrong, and we just give a medicine, boom, and you're out the door. Just because you have panic, we have no idea why this person has panic. We just know they have this particular symptom, but we have to actually get to know this person, their life, their setting, their circumstance, what's going on with them that's actually causing this panic before we can actually intervene. Just saying you have panic doesn't tell us really anything other than you have these symptoms. But why? So medicine, yeah, we can hit the brain with certain meds that will cause a certain physiological result for a transient period of time to make the symptoms go away. But it'd be like this, having somebody with a broken leg and they're saying, I'm in really bad pain because I got a broken leg. Okay, great, here's some morphine. I give you some pain medicine, you won't hurt. Okay, we hadn't fixed the leg.
Right.
Okay, and this is what's going on with a lot of psychiatry is you just throw meds to numb things, but you don't fix what's actually broken that's causing it in the first place.
We have to answer the question why. Why are these things happening? Listen, we have so many questions that have come in. We're not going to be able to get to them all, but we're going to have Dr. Jennings back again, and we're going to keep answering your questions. You can go to the website, heartwiseministries.org, and we'll try to address some of these issues that you might have. Dr. Jennings, we have a little bit of time left. What would you like to leave with our audience today as some parting words here?
Well, what I'd like to say to the audience is that God has constructed life to operate in certain protocols, principles, some call these laws, that life is built to operate upon. If we, physical, relational, spiritual, psychological, if we live in harmony with those laws, we're healthier, and then because we're healthier, we're happier. If we break those laws or those protocols, then what happens is we start experiencing problems. First, initial pain, discomfort, and then disease, and then dysfunction. And so I would encourage you to understand God's design for life and live in harmony with it.
Thank you. And we want to thank each one of you for watching. We want to thank Dr. Jennings for giving his time to answer your questions. There's no bills with this. We also want to remind you that there's a place for modern medicine. There's a place for lifestyle. But it's in that relationship with the Heavenly Father that we can all be assured that we're going to find healing. Well, you can join us every week at this time on your local station. We're glad you're joining us. Become one of our Facebook friends. Want to talk about Dr. Jennings' book, Could It Be This Simple? And his new one coming out later this year called The God-Shaped Brain. Thanks for joining us. We're going to be back next time.